Hi, everyone. I'm Elaine Quijano. It's good to be with you. Thanks for joining us. President Trump says he's backing out of talks for more coronavirus relief as he continues to downplay the threat of the virus. It keeps spreading throughout the White House and now the Pentagon. The news came, as it often does, via tweet. Mr. Trump says the two sides are $800 million apart and that he instructed his team to stop negotiating until, quote, after the election, when immediately after I win, we will pass a major stimulus bill. More than 80 million Americans received the one-time government payments earlier this year, and many of them were helped by a $600 added unemployment benefit. But now more help appears off the table at least until November. The Dow Jones Industrial Average dropped more than 400 points, 1.5% of its total value after the president's tweets, closing around that mark this afternoon. After 4 days at Walter Reed Medical Center, President Trump appeared to struggle to catch his breath after climbing White House stairs last night. The president's doctors say he is symptom-free, but as our chief medical correspondent explains, that doesn't mean he's fully recovered, nor does it mean he's no longer contagious.
That first week, people can have symptoms that can be serious, but they may be relatively milder than the second week when you suddenly get inflammation, this inflammatory phase, and that's where people can really very quickly go south. We have to assume that the president still is contagious, that he's shedding virus. That you're not considered free of the ability to infect somebody else for about 10 days after you develop symptoms.
COVID-19 has killed more than 210,000 people in the United States. President Trump's message to Americans after leaving Walter Reed was to not worry about the virus. That, even as he receives medical attention far superior to what the average American has access to.
I learned so much about coronavirus, and one thing that's for certain, don't let it dominate you. Don't be afraid of it. You're going to beat it. We have the best medical equipment. We have the best medicines, all developed recently, and you're going to beat it.
Bloomberg's Jennifer Jacobs, who first broke the news of Hope Hicks' positive test last week, reports that one of the president's military aides and one of his valets have both tested positive for COVID-19. CBS News has confirmed that several members of the Pentagon's senior leadership team, including Top General Mark Milley, are quarantining after the Vice Commandant of the Coast Guard, Admiral Charles Ray, tested positive Monday. It's not clear where the admiral was infected, but he attended an event at the White House the day after the ceremony for Judge Amy Coney Barrett, which has been linked to significant spread. Meanwhile, the campaigns say Vice President Mike Pence and Senator Kamala Harris received negative results ahead of Wednesday night's debate in Utah. Democratic presidential nominee Joe Biden campaigned in Pennsylvania today, where a new poll from Monmouth University shows the former vice president leading President Trump by 8 to 12 points, depending on voter turnout. Biden has returned to criticizing President Trump's handling of the virus after he's returned to the White House.
Set partisanship aside. Let's end the politics and follow the science. Wearing a mask is not a political statement. It's a scientific recommendation. This virus doesn't care whether you live or where you live, what political party you belong to. It affects us all. It will take anyone's life. It's a virus. It's not a political weapon.
Nikole Killion, Caitlin Huey-Burns, and Meridith McGraw join me now. Nikole is a CBS News correspondent. Caitlin is CBSN's political reporter, and Meridith is a White House reporter for Politico. Welcome to you all. Meridith, let's start with you and the president's decision to pull out of talks for a COVID relief package. Why now?
That's a good question, and that's something that his aides and people around him are certainly going to be asking. Although Senate Majority Leader Mitch McConnell has said that he did support the president's decision, This all comes right before the election. There was some hope that there could be a stimulus relief bill that could be voted on before November 3rd, but of course that's not going to happen now, and the president has called that off in the form of a tweet. This could be some kind of negotiating tactic for the president, but there are questions about why he decided to do it at this moment. There were a lot of competing factions, even within his White House. Treasury Secretary Mnuchin, who had been leading negotiations for the White House and had been pushing proposals back and forth with House Speaker Nancy Pelosi. He was in favor of one, but others within the White House were a little skeptical of some of the numbers that they were seeing. They were far apart on some of the policy and the top line numbers that had been presented. So although it's not entirely surprising that the president decided to pull the plug here, there are a lot of questions about why now. And of course, it came right after the Fed chair had encouraged some sort of stimulus to go through, and before the markets even closed. And we saw immediately the results of the president's tweet, and just seeing the stock market take a dramatic dip.
So on the stock market, Nikole, just this morning, President Trump said on Twitter that the stock market wasn't getting enough attention. How much does the decision not to continue working on economic relief undercut that message?
Well, it undercuts it in the sense, as you mentioned, and as Meridith mentioned, the stock market did drop several hundred points following the president's tweet. But potentially this could undercut the argument of both sides, quite frankly. Having had the opportunity to get out and talk to voters over the last couple of weeks, I talked to one in North Carolina not too long ago who told me, as far as these negotiations, whether this package was $1 trillion or $2 trillion, it doesn't matter. The difference is not that far apart as far as this voter was concerned. They just wanted to see both sides come together and get this done. I spoke to another voter in a completely different state of Nevada a couple weeks back who has been unemployed for months now and whose unemployment was set to run out. And as we know, unemployment benefits lapsed back in late July. So again, for the average person out there, I don't know that they necessarily care about the minutia of this deal. And as Meridith said, these negotiations have been on again, off again for several months now, and I think the average person just wants to see both sides get something done. So to the extent that that could backfire on the president and Republicans or Democrats for that matter, again, will remain to be seen in the election.
So, Caitlin, the president's doctors say he is not out of the woods yet. But how is the campaign trying to frame the issue of the coronavirus based on the president's own experience now?
Well, you heard the president say himself that move on with your lives. Essentially, this is not that bad. And the message that the president is trying to send is one that fits his reelection campaign message, which is that the coronavirus pandemic shouldn't be front and center. And that's because the campaign doesn't want this election to be a referendum on the president's handling of coronavirus. Why? Well, we see in poll after poll after poll, nationally and in key battleground states, that the president receives negative grades for his handling of the coronavirus pandemic, and that is something that is contributing in a big way to his falling behind Joe Biden in many polls. So as long as this election and the campaign is focused on coronavirus and the pandemic, that is not a winning argument for the president's reelection campaign. And that's why you've seen him try to go out and put a positive spin on this. And that's something that we've seen throughout the White House, even as several members have been diagnosed with the coronavirus, and the president himself just spent a few days in the hospital. Remember, he is given the best medical attention that is not given to average Americans. And of course, over 200,000 Americans have died from this virus. So the president doesn't want this to be center stage of the campaign because it's not a winning message for him. And that's backed up by what we're seeing in the polls.
Meredith, let me ask you, a White House reporter who tested positive after attending the Amy Coney Barrett Rose Garden ceremony told CNN yesterday that he has not been contacted for contact tracing from the White House. Do we know actually what safety steps are being taken here by White House officials?
Well, contact tracing at the White House is run out of the White House's medical unit. They're the same folks that administer tests to aides in the White House, people who are in close proximity to the president, and even folks like me, reporters who go into the White House and are in the pool and who might be around the president. We're all given tests by those folks, and they're also running the contact tracing there with the help of one CDC epidemiologist who has been handed over to the White House since the beginning of the pandemic to help out in events like this. But there's still a lot of questions about what exactly is going on with this contact tracing. As you mentioned, one of the reporters who was at that event on Saturday wasn't contacted. And anecdotally speaking, I've talked to quite a few people who were at that event on Saturday in the Rose Garden. One who was in the events indoors at the White House as well, who was not contacted by the White House. Now, a couple of White House officials have tried to defend their contact tracing to me. They said they have contacted people who have tested positive or people who were around the president or somebody who tested positive in at least 48 hours. But as we've seen just from the past week, more and more people are testing positive, and there's a lot we don't know about this virus, but one thing is for certain, it is highly contagious. And right now, we are seeing that play out in real time in this White House as these public figures, one after another, who were in close proximity in the White House, working closely together, or decided not to quarantine after being in close proximity with somebody who did have the virus, are now learning of their test results.
You know, Meredith, as you well know, there has been this lack of transparency as well. President Trump's doctors would not say Monday when his last negative coronavirus test was. Is it clear why they would want to conceal that information?
No, it really isn't. You know, after we learned that Hope Hicks, of course, one of the president's most trusted aides, had tested positive for this virus, we started to try to piece together the timeline. I know that the president first learned that he tested positive for the coronavirus after he returned from a fundraiser in Bedminster, and he learned of his positive test results, and then he went on Sean Hannity's show and he talked about it, that he said that he had been tested again and was waiting on those results, but he did know in that time period he had already tested positive. But still, what remains unclear is when the president was tested before. One of the things that the White House and aides there at the White House have really leaned on is the fact that so many people are tested all of the time. And I think that's kind of created a false sense of security and a false sense of confidence among a lot of the aides over there. And just because you have a negative test result doesn't mean that later that day you might contract the virus. And the fact that the White House hasn't disclosed when the president last tested negative raises questions about how often he was actually being tested for this virus. And I know that there is more testing that is going on over there at the White House. That's how we've learned today that one of the military aides who works in close proximity to the president in the West Wing tested positive over the weekend, and then multiple press aides to White House Press Secretary Kayleigh McEnany, we've recently learned, have also tested positive as well. And officials have resigned to the fact that they're expecting more positive test results. And, you know, we all wish them well and hope that they're healthy and safe, but also, of course, quarantining and trying to adhere to best practices in the West Wing, as we all know that that's such a small enclosed space to work.
Yeah, I think many people at home would be surprised at just how cramped those quarters really are in the West Wing. Caitlin, let's move to where voters are now on all of this. A new CNN poll shows President Trump trailing Joe Biden by 16 points nationally. Now, some of this could be what's known as partisan non-response, when supporters of one side decline to participate in polls after significant bad news. But Caitlin, what has the past week shown us about what voters think of how Republicans are handling the virus?
Right, and these polls, especially national polls, are a snapshot in time. We don't have a national election. This is a state-by-state election, but they do show us kind of where voters are on certain issues. And a couple of top lines that stood out to me from that poll is that Joe Biden is leading Donald Trump on several key measures of the day, not only response to the coronavirus pandemic, but also on the issue of health care, on the issue of crime, and also on the issue of who's better equipped to be appointing Supreme Court nominees. Now, they are tied on the economy, which has been the silver lining for the president and a reason that he wants the economy to be front and center of this campaign and not the coronavirus pandemic. All of these issues will likely be discussed here in Salt Lake. Behind me, you can see the University of Utah Stadium where the debate will be held. And there are negotiations right now about whether to have plexiglass between the two candidates. We're seeing reporting just now that Mike Pence doesn't want that plexiglass around him, and more evidence yet of how much the re-election campaign for President Trump and Mike Pence don't want the coronavirus to be front and center of this campaign.
All right, Nikole, let's talk about this a little bit more, because both you and Caitlin are, of course, there in Salt Lake City ahead of the vice presidential debate. Let's go ahead and play a clip from your new interview with Trump campaign communications director Tim Murtaugh, specifically about the safety measures their side is taking.
I know it's very close to the election, but are there any concerns about putting the vice president out there? I know he's been testing negative, but still, do you have a contingency plan if he were to get sick?
The vice president has consistently tested negative and continues to do so. And when we go to our events, we have safety protocols in place. We test everyone for a temperature before they're even allowed to enter. We provide every attendee with a mask and encourage them to wear them. We hand out more hand sanitizer than any group of people could ever possibly want. And you also have to remember that the president and the vice president are also socially distanced from attendees. And so we are very confident. White House operations is very confident. The White House medical unit is very confident that the vice president will be safe in going to those events.
All right, so Nikole, we heard Tim Murtaugh there. What else can you tell us about the safety measures being put in place for the VP debate? Because as we saw during the presidential debate, some people who were wearing masks upon entry into the debate hall then proceeded to remove those masks, mainly members of President Trump's family. So what else can you tell us about some of these safety measures?
Well, I did ask Tim Murtaugh about that because we have noticed that the debate guidelines have now specified that if people don't wear their masks, that they could potentially be escorted out, which they didn't say ahead of that first debate. And so I did ask Tim if, folks from their campaign will comply with that, given what we saw from the Trump family last week. Now, he responded by saying that, members of the family had been tested for COVID, that they were negative, and that he did not think that anyone had been asked to take to put masks on. But that being said, the Cleveland Clinic said that masks were offered, and so, it kind of goes back to pointing fingers here. That being said, I asked him this time around if people will wear masks if they are asked to, and so his response was that they would do their best to comply with the debate commission, and that they have continued to negotiate these terms, and that they will do their best to adhere to the rules. As far as the plexiglass is concerned, again, it's kind of the debate before the debate, because we have learned that the Pence campaign and the Trump campaign does not want these plexiglass dividers, that they feel that it's fine if Senator Harris wants it, if the moderator wants it, but they don't feel that that is warranted for the vice president. Furthermore, as far as a response from the Biden campaign and Senator Harris, they are pushing back already and saying that, they want to adhere to the guidelines set by the Cleveland Clinic, which is essentially the health advisory group that is advising the debate commission on this, and taking some pretty pointed jabs at the Trump campaign as well by saying, if they want to continue their war on masks with a war on safety shields, then that just goes to show that their response has been a failure. And I'm kind of paraphrasing the statement they put out, but that was kind of the gist of what they said. So again, we already see the two sides going at it well before this debate gets underway.
Right, all of that, even as the President of the United States continues to fight this active COVID infection. All right, Nikole Killion, Caitlin Huey-Burns, and Meridith McGraw, thank you all very much. Really appreciate it.